Hello and welcome to Birth as We Know It. I am your podcast host, Kiona Nessenbaum. I have experienced birth as a doula, a student midwife, and as a mother of 3 amazing children with my husband and high school sweetheart by my side. After attending over 130 births, including my own, I've realized that each birth experience is truly unique. So make sure you subscribe and join me every week as we are guided through many different birth experiences through the lens of the storyteller. Please be aware that some of the stories can be triggering to hear, so feel free to pause, take a breath, and come back and listen whenever you're ready. With that said, let's prep ourselves to dive deep and get detailed about what really happens in the birth space. As a reminder, this podcast is intended for educational purposes only and has no intention of giving or replacing any medical advice. All advice that is given on the podcast is from the personal experiences of the storytellers. All medical or health-related questions should be directed to your licensed provider. Before we dive deep into this episode, I want to give a special shout out to my sister Oz. Oz, thank you so much for being my very first patron and member of my Patreon page. Thank you for supporting me in the production of this podcast, and it's because of you that I am able to continue to do what I am doing. Thank you so much for being my number one cheerleader. All right, on to the episode. Hello, everybody, and welcome back to the Birth as We Know It podcast. Today, I am super honored and ecstatic to interview an old friend of mine. Her name is Muna Habib. She is currently a student nurse midwife and practicing as an RN and has some experience as an RN in the OB ward. So welcome, Muna.
Thank you so much. I'm so excited to be here.
Yeah, I'm super excited to interview because I remember when we first met, it was actually through you shadowing as a doula, which was a while back, and you have come very far.
It seems like it's been so long ago. I was thinking about that. Like, wow, Kiana was like part of my sort of career in birth, like getting into the birth world as a doula. Yeah, and that was before I was an RN and now before I was a student nurse midwife. So yeah, you played a big role in me continuing on. So
Oh, well, I mean, I think that's awesome. I think that I would say I probably didn't play a huge role just because it was all you. You know, it's like all your passion, it's your commitment, it's your desire to want to be in birth. And it was super awesome and fun to have that experience with you as well because I was, a doula for a few years at that time, and we were just chatting about all the things, like asking all the questions about like, what would you do here? What would you do there? And it was fun. It like kind of made me actually think hard instead of being like, I just do it, So yeah, it was a lot of fun. And that was an out of hospital birth
That's right.
that we were a part of together.
I think so. Yeah, it was a birth center birth. Yeah, I mean, yes, there's my part of the motivation, and then there's also just having really, really good mentors throughout all this way. I think that having a mentor is just so important because, yeah, I if that makes or breaks some of your experience with regards to how you see birth, how you interact with people, and so, anyways, you've been a lovely, wonderful mentor for me.
Oh, well, great. Thank you. Yeah, I think that it was awesome. And you also taught me things as well with just the questions that you were asking at the time. So I think you also play a big part in my development of just continuing to love birth, and being able to help guide others through that path as well. So
Lovely. Well, I appreciate it.
Of course, of course. All right, so let's go ahead and dive right in. And how about you tell all the listeners a little bit about yourself and what you do, where you practice, and all the things.
Sure. Yes. So, as you mentioned, I am a registered nurse, now a student nurse midwife. I started out, let me think, I'll go back to graduated from sort of my baccalaureate degree, my undergrad degree in sociology. At that point, I hadn't finished my nursing degree. I was still kind of toggling between being an MD, a DO, versus kind of a nurse practitioner. And so it took me a little bit to get to the NP route, the nurse practitioner route, which is what CNMs are as well. Um, After I graduated from UW in 2015, I worked for about a year and a half as an OB medical assistant. And I worked in a practice where there were two MDs, one DO, and one CNM. And that was kind of my first introduction to who a CNM is, and also my first introduction to the OB sphere. So that kind of led me down the path of OB. I really, really, really enjoyed the patients a lot. It was just a fun sort of department. It was so welcoming, so warm. It's not like sort of the cold hospital, cold clinic where you're seeing patients who are oftentimes sick or have a lot of, concerns with regards to their health. So
Mm-hmm.
it made me excited to go to work. And as I was toggling my way through sort of my career, that's when I met you, of course, and I was considering the options to become a midwife, and so there was the CNM route. There's also the LM route, the licensed midwife. I had done a tour at Seattle University. That is the program that I'm in now, and I had also toured Best Year. And I just wanted to really get a sense of those differences. It was at Best Year that the representative had told me, like if you really want to get into the birth world and you want to figure out how that looks for you, maybe you should try becoming a doula. So that's how I became
Mm-hmm.
a doula. That ended up, I think that was in 2017, 2018 is when I met you.
Mm-hmm.
And then, yeah, eventually found myself wanting to become a CNM because I wanted to work in all settings. I didn't know whether I wanted to do a home birth center, or work in a hospital practice, but CNMs can work in hospitals. So that's how I got to applying for Seattle University. So as I started this route to CNM, it's an accelerated nursing immersion program. So you do all of your nursing school credentials to become a registered nurse in 5 quarters, as opposed to kind of the traditional style of 2 years for the baccalaureate for the BSN. So it's an accelerated BSN. So I did that in 2020. And at that time, I was also working as a perinatal coordinator for a community health clinic here in Seattle. And so I was working in their midwifery department and really getting to know all the midwives there. And then became a RN. So 2020 during COVID times, became an RN by, what was it? Passed the NCLEX by like October 2021, and
Mm-hmm.
then started working as a registered nurse and an OBRN in the clinic world. And then it took me 2 more years. The program that I am in is a doctorate of nursing practice program, so it's a doctorate
Mm-hmm.
NP degree, and so that's a 3-year degree. So now I'm in my last year, and my third year, where we're doing clinicals and learning how to be a midwife in practice. So yeah, that's where I'm at today.
Wow. Yeah, that is amazing. That is such a path and such a journey to just, this is like, it's funny because when I hear all of these things, this is just another start. You know what I
Yeah,
mean? Like this is
totally.
another start. It's not the end. It's not the finish line yet. But I think that's so awesome because you're so close to being the primary provider and doing all the things.
Yeah.
You've worked so hard to get to this place and you're going to be doing all of the things. And I'm going to be messaging you like, Muna, like, what do I do? Like, we're going to develop like this relationship where I'm going to, I don't know, I'm not a midwife, but I just imagine that I could talk to some midwives that are out in the community and be like, hey, Muna Habib is a CNM. Like, send your clients there, chat with her,
Oh,
develop this relationship. So I think that that's going to be really cool.
I love that. I think that it's so lovely when we can integrate and connect, and just have that sort of interprofessional collaboration.
Mm-hmm.
I've always leaned into my connections. So when I was starting out getting into the birth world here, in addition to meeting you, I was trying to get set up with some of these local organizations who train doulas, and I was trying to connect with a whole bunch of other like more seasoned doulas just to kind of understand
Mm-hmm.
how they practice in the community. And I think it is so important to know who the people are in the community when, for example, a patient comes to you and they say, I think I want I think I want to establish with a birth center, like this is great, but this is what I envision for my birth is maybe it's not in the hospital. And so
Mhm.
to have those names that you can say, oh yeah, I know that person. I'd be happy to send you a referral over there, or I can send your records over there. I think it's really important. So I love that. I love that vision.
Yeah, I agree 100%. I think that it is super important. And it makes me think of someone that I've interviewed previously, Faisa Farole,
Hmm.
the midwife that's in Federal Way. She's opening up a birth center, but she practices in a way that is just truly amazing, where, she supports people prenatally and postpartum who know that they want to birth in a hospital, who know that that's where they want to go, and those are the things that they want to do because that's where they feel safest. But she also wants to be able to provide that midwifery model of care with like the longer prenatal visits and things like that. And I know in hospital settings that's possible, but it's not as lengthy. The prenatals don't have as much length to them sometimes. So
Totally.
having that collaboration with having all of the patient's needs met is good, because you're like, hey, it could be a midwife to midwife transfer, to where
Exactly.
it's just smooth and you're still listened
Seamless.
to, and yeah, very, very much seamless. And I'm not saying OBs are the wrong, whatever, like OBs are awesome. OBs are there
Yeah.
for a reason as well. Like OBs practice in such amazing ways as well. It's just having those professional connections and being able to have it be a seamless thing is amazing. So
Yeah, and I think what you mentioned is super important as well, to have that sort of trust in some of our midwives that are in home birth practices, that are in birth center practices, and have that understanding of, oh yeah, I know that they did everything they could for this person, and then maybe something else happened where we have to have them come in, and just
mhm.
developing that, because I mean, I personally have an experience in a hospital transfer, where I'm at right now, but there are instances and anecdotes that I've heard where nurses, potentially providers, just don't have sort of that trust in like birth center and home
Mhm.
birth practices, and like that's maybe also sort of a lack of knowledge of like of the safety of it, because it's a
Mhm.
beautiful way to attend a birth. It's a beautiful way for a person to have a birth, and just understanding like some of the sort of limitations, and trusting that your provider, in that home birth or in that birth center space, will know when, okay, this is too much, for the resources we have here, and we'll need to transfer you in hospital. And having that sort of understanding and trust in that person, I think it's super important. And I work with FISA actually. I really, really like her a lot. I worked a couple of months, consulting in a contraception clinic for her. So,
Mhm.
in addition to some of the the work that I've done as an RN, and sort of in the community health world, I've been doing consulting sort of on the side hustle, as I tend to do, because I can't just do one thing, it seems.
Right, right.
Um, so I really, really think FISA is wonderful. Um, and yeah, the other consulting project I had, it was a reproductive health and birth control session for Afghan refugees.
Hmm.
Um, so yeah, a health session, and it was just one health session for Viets for Afghans, a nonprofit community. So, anyways, so that's what I kind of envision myself working in a similar like aspect, where I'm a CNM, but I'm not just a CNM limited to one sort of group practice. Like, I'm a CNM for the community in a sense,
Mhm.
and still fostering some of those connections.
Yeah, I think that is absolutely amazing. And I love to hear that so much, because also with me having met you as a doula, being in the birth space in an out of hospital birth setting, knowing that you're doing your due diligence in getting to know all playing fields, if that makes sense. Like
Totally.
getting, like, not just only practicing in a hospital, like you also experience births in out of hospital settings, and like what that looked like and how you felt about it, the questions that you asked the providers at the time.
Yeah.
And, just picking everybody's brain to get all the information that you're wanting to make a informed decision about what you're going to do. I love that. I
Yeah.
think that's so great. I think all CNM should do that. I think I think that all providers that are supporting birthing people should experience births in all settings that birth happens.
I completely agree with you.
Yeah, it's so easy to, because if you're trained in a certain way, like if you're trained in a specific way and the only setting that you're trained in has all of the resources, like for emergencies, like in a hospital setting, that's what you expect birth to look like, and that's what you expect birth to have around at all times, is like, oh, the OR's right down the way. you know
Mm-hmm.
like we can
Totally.
kind of push our limits a little bit with the OR right down the way, knowing that we have that safe space to deliver the baby in a safe manner in an emergency. Now, in an at hospital setting, you were saying that, it's the client's job, or not the client's job, but the client's ability to trust their provider
Yeah.
in knowing that their provider is trained enough and educated enough, which out of hospital midwives are, to make
Yes.
those decisions in
Mm-hmm.
saying, hey, I see that X, Y, and Z are lining up right now. So let's have that discussion about what a transfer looks like,
Mm-hmm.
rather than it being emergent. Are there some emergent situations? Absolutely. In every
Totally.
birth setting, there's emergencies, but it's talking about those beforehand and prenatal time, and just knowing, like, in an emergency, these are the things that we do. And most people end up having a super healthy baby
Yeah.
and their births are fine. But of course, every location has traumatic births as well. So it's not
Yeah.
just one setting. But yeah, I think it's
Totally.
awesome. So,
Thank you. Yes, I think so too. And I'm fortunate enough to have faculty who, and also mentors who trained as licensed midwives prior and then
mm,
became a CNM. And so have a lot of the birth center experiences. I have a couple of classmates who are doing clinicals in birth centers and practicing with licensed midwives. And so I agree with you. Like, I think that all CNMs should shadow and should, have kind of an understanding of some of these home birth and birth center practices. And I think it goes both ways. Like, I would love to see licensed midwives and CPMs also kind of shadowing CNMs too, and saying, okay, like, what is involved and what is a little bit different, and what can I tell people when they're trying to, kind of understand the differences. Because a lot of the times you hear, oh, midwives, so you give, you give birth at home, or deliver babies at home.
mm-hmm,
Okay, well, there is a little bit of more of a spectrum of midwifery. And so
mm-hmm.
kind of having that understanding and background to be able to provide people with the best, like, sort of knowledge and understanding, so they can make a decision for themselves, or they could have sort of a full picture to make an informed decision on where they'd like to give birth.
Yeah, no, I think that's awesome. And I also really enjoyed you bringing up that point again of, like, everybody that is supporting birthing families does shadow in every setting,
Right.
because just like I had mentioned before, like, licensed midwives are trained completely differently than CNMs. And so, of course, there's
Totally.
some crossover. But, like, if licensed midwives can see what it's like in the hospital and see how birth happens in the hospital settings or the CNM settings, to have that seamless transfer when needed, to have that collaboration and things like that. And it's interesting because it makes me think of Jenny Joseph. So Jenny Joseph is a midwife who practices in Florida and has this way of practice called the JJ way. And it's
Mm-hmm.
basically, she had mentioned it herself, that it is the midwifery scope of practice model of care, but instead of being midwife or provider centered, it is patient centered. And that
Mm-hmm.
means sometimes having to take, like, being the provider and having to take yourself out of the middle of it to do what's best for your patient or your client.
Totally.
So making it to where the patient is centered in the way that you practice, and making those collaborations, making those
Yeah.
connections, so that, hey, even though my client doesn't want to birth in an out of hospital setting and I'm a licensed midwife, I can still do all that I can to support them in the way they want to be supported, and then know that I'm not catching the baby, but that's okay, you know?
Yeah, totally. I love it. I love it. It sounds very midwifery. Like, midwifery model of care is a whole nother sort of patient care lens of, like, shared decision making and
Mhm.
really elevating people to where there is no sort of hierarchical, I'm a provider, this, sort of
Mhm.
superior mindset, but you're shared in this sort of decision making, and you're lining out each person, each patient, each birthing individual's priorities, and then trying to understand from where you're coming from as sort of a source of truth and a source of evidence-based practice,
Mm-hmm.
and trying to find that balance between the two. So I think that's lovely.
Yeah. The way that you are explaining how you are educating yourself and going along this path of getting to where you are now reminds me of that kind of smoothness and the well-rounded collaboration and education and informed decision making. So I love it all. I love it all.
Yay.
Yeah. So another question that I would love to ask is what inspired you to get into the birth space?
hmm so really, as I mentioned, my first sort of introduction to the birth world, to OB, to gynecology was when I was a medical assistant. And when I worked with all three of those different providers, the MD, DOC, and M, you could really, really tell the differences between how the midwife I worked with practiced versus how the MD and DOs. And that midwife, everybody like loved her, and you can tell it was just like family. Like it was
Mm-hmm.
always, oh, there's that. I'm going to see my midwife, and it was a lot of nursing scope of practice as well, where you're kind of at the bedside and it's holistic care where you're looking
Mm-hmm.
at every patient's life experiences. And so I think that's a beautiful way to practice.
Mm-hmm.
I think when you're seeing people as if they are your family, like, oh, this is a person that reminds me of my mother, my sister, then you take sort of this understanding that this is a person that I am a person that I'm caring for, not just a patient, a
Mm-hmm.
person.
Mm-hmm.
Um, so that's what led me to OB. And then when I became a doula, I was validated and sort of reaffirmed that, yeah, this is exactly where I want to be. Like, I want to be supporting birthing individuals. I want to be supporting women, and oftentimes a lot of their most vulnerable experiences. It's such a it's such a moment in a person's life to give birth, and whether that's for themselves, whether that's for surrogacy, it's all different sort of types of how do I say, kind of not ways to give birth, but understandings about birth that I think are just so impactful. And then also not just in the birth space itself. So as I started working as an RN and working in a community health clinic, I really understood kind of my role as a future provider, because in this community health clinic, I work with a patient population that is primarily under resourced, that are immigrant, refugee communities, low income populations, a lot of non English speaking people. And I see them like my aunties, and I see them like,
Mm-hmm.
people I grew up with. And it's the first practice where there's another Muna working like for the clinics, and I haven't
Mm-hmm.
seen that in these other spaces I worked in as a medical assistant, and even now doing some clinicals. It's different than community health.
Right.
And so I feel so rewarded by caring for this population. And I also think that as a BIPOC person, it gives patients also a sense of trust. So when I'm introducing myself, oh, I'm Muna, I'm the nurse, talking with you today, or whatever. They're like, oh, we have a Muna, we know Muna, like
Mm-hmm.
in our culture and our understanding, and it level sets sort of that visit, and it also makes people relax a little bit more, because
Mm-hmm.
oftentimes in a lot of these communities there's sometimes mistrust in the healthcare institution itself, and so finding people who are like you, who you resonate with, I think is so important. Yeah, so that's kind of my long way of saying of getting around to how I got interested into the birth community and just don't want to leave.
Yeah, yeah. I mean, honestly, once you're bitten by birth, it's like there's no going back from that. You're in it. You got the bug, and
It's
it's
so
more
true.
of yeah. It is crazy true because birth is constant. It is the thing that is forever happening. And the way in which birth happens is consistent, but the policies and things around birth change. And so I think that
Totally.
that is interesting as well. But yeah, I love it. I love how you connect that aspect of cultural, not necessarily cultural acceptance, but cultural exposure of just being a Muna,
Yeah. Right.
being Muna. And they were like, hey, I know a Muna. And then they
Uh-huh.
go into like, oh, the Muna is my cousin or like my niece or,
Exactly.
and it puts that, like you said, leveling the visit to where it's that understanding of just being relatable and having someone that looks like you or sounds like you or can relate to you being part of your healthcare team, which is super exciting.
Yeah, totally. Totally.
Yeah. So I love it. Woo. Um, so as a student nurse midwife right now, how many births have you attended so far since you've started?
My practice isn't as right now, the clinical practice that I'm with isn't as high volume as some other practices around the area. So I have 5 births, 5 vaginal births, and then 2 cesarean sections right now. So 7 total.
Mhm.
And yeah, I mean, I think it's having sort of a steady start into this year that I'm going into is great. I would like to have more births, but I have a lot more time too.
Mhm. Of course, yeah.
Yeah, so that's the number of births I got so
That's
far.
great. That's great. And that's as a student nurse midwife, right?
Yes, exactly. Yeah, so I have more
Yeah.
births as a doula, and yeah.
So how many births did you attend as a doula prior to becoming a nurse midwife student?
Uh, I think it was for that year that it was 3 or 4. And then as a medical assistant, I also shadowed and observed a few births. So I probably have closer to 15
Mhm.
when all is said and done. Yeah. And what I really enjoyed about some of these, I mean, I've seen it all from like a birth that ended in a cesarean section versus a birth that was precipitous, so
Mhm.
very fast, and a home birth, which I attended as a doula, and then birth center. So yeah, I've kind of seen a wide diversity of births.
Yeah, and I think that's amazing. And you've seen that wide variety with just 15, you know?
Yeah,
And I can't even
totally.
say just 15 because for a common like Jane just walking out on the street to have seen 15 births, that isn't
Right,
in the birth field would be interesting to say enough. But I
totally.
think I think that's awesome. Like each of those births have impacted you in some way to prepare for the next, you know?
Totally. Yeah. I remember little things about each and every one of them. And yeah, it does. It shapes your way of sort of knowing about your who you are in a birth space. It
Mhm.
shapes the way you are communicating with people and with patients in that realm. Yeah, it helps me become a better provider each birth that I'm seeing. So
Yeah, I think it's awesome. I think it's super awesome. And tell me how it was being part of the cesarean births as a student. Like, what does that
hmm
entail?
so for this quarter, I had 2, and one of them was sort of an emergent cesarean, and the second was a scheduled cesarean. So as a CNM, you're not the primary attendant of a cesarean section, you're a first assist. So
Mhm.
as a SNM, so student nurse midwife, I'm a second assist. And yeah, that's actually one of the birth experiences I was thinking about speaking about because one of the cesareans that I was a part of, as I mentioned, was emergent.
Mhm.
And so this patient in particular was trying for labor. It was a surrogate pregnancy.
Mhm.
And baby wasn't, it, we called a cesarean for arrestive descent. So baby wasn't kind of moving down the sort of vaginal canal, if you will, as we would have hoped, and wasn't tolerating labor super well. So there was a pushing trial, if you will, for this patient,
Mhm.
and she was a high risk patient. She was advanced maternal age. It was a surrogate pregnancy. she had chronic hypertension, and in
Mm.
labor,
Mhm.
that superimposed to preeclampsia. And then in labor was later diagnosed with IAI, or intra-amniotic infection. And so it was a
Mm.
very, very high risk sort of birth. So when she tried to push, baby decelled to 50, 60, I think, beats per minute.
Mm.
And that happened a couple of times where we were like, okay, baby is not quite making it through to the point and tolerating a vaginal birth as well. We had a discussion about cesarean section, which this patient was well kind of prepped on and knew that like it might have needed to get there. So second assisting, first assisting is really kind of holding some retractors, getting a
Mhm.
good visual field for the OB to be able to deliver the baby. And
Mhm.
then this baby didn't tolerate earthside as well as we would have liked. So automatically in a cesarean section, we deliver babies, and the midwife takes the baby to the NICU team, so the NICU nurses, and
Mhm.
they kind of stimulate baby and make sure baby's breathing okay. And in this particular delivery, baby wasn't breathing, and we had to call a code. And so their APGAR scores, their 1 minute APGAR was, I think, one, and then
Mm.
or a zero, and the 5 minute was one, and then the 10 minute was seven. So after the code, they got baby going, and in that realm too. So we're still by the mom. We're still the ones helping to close up this
Mhm.
patient while a code is happening in the background. So
Mhm.
that was a little wild to see for sure.
Yeah, and man, that just kind of goes to show that each person in the birth space should have a role,
Totally.
should be doing a specific job. Because imagine if, let's say you helping in that scenario, if you were to go run and help with the code, then
Right.
where would the person be that's helping close up? Like both
Exactly.
the birthing mother in this situation, this birthing person is just open, and needs to be
Totally.
closed and is in need of care just as much as the baby,
This baby. Yep.
So,
And she's awake too, by the way. So like,
mhm,
cesarean sections, you're oftentimes not completely under anesthesia where you're not
mhm,
awake, but it's conscious, somewhat conscious sedation. So she's also seeing that in the background. So there's a lot of our role as a CNM as well is to um, support this birthing person and to let them know,
mhm,
okay, you're going to be feeling a lot of pressure at this point. Okay, this is what I see that's happening with baby, but you're
mhm.
doing a really great job. We're almost finished closing you up. And so, really kind of offering reassurance when you can and being that support person while they're still under.
Yeah, yeah, and I think that's really important, actually, that you mentioned that, because communication with this family is super important and key at
Yeah.
this time as well,
Hmm.
at all times that they're in your care, but especially at this moment with it being an emergent cesarean and with the baby, not responding as well to being earthside as people would like. So,
Hmm.
yeah, goodness. Whew, that was a good
Yeah.
one.
It is a good one. It was probably the highest acuity case that I've had this quarter.
Hmm.
So that's the other part about kind of a CNM. You're not super limited with regards to the types of patients that you can take on and the types of birthing individuals. Sometimes people have the thought that as a midwife, you could only take sort of the lowest risk patient, and there
Mhm.
are things that may risk you out. But as a CNM, there's not a lot of things that can risk you out. You can have a comorbidities. So you can have a history of high blood pressure. You can have a history of thyroid disorders. You can have you can have gestational diabetes,
Mhm.
and you can still be under the care of a CNM. And some of those things that would most likely risk you out are multiple gestation, so like twin pregnancy, a comorbidity that might be managed better by an OB, so type 1 diabetes, for example, insulin dependent, maybe a chronic condition like chronic kidney disease or a pregnancy that might have a baby or a fetus with genetic anomalies. So those
Mhm.
types of things are kind of you weigh out a little bit more. And also, there are often times that we see patients that are like, well, it's difficult for me to get to the OB versus seeing my midwife where parking is free. Like, where
Mhm.
people have social determinants of health and troubles and concerns with access issues. And so, can we find this sort of balance of co-management with OBs and CNMs? And that's also important as well. We talked a lot about interprofessional collaboration between licensed midwives and CNMs. Well, with CNMs, there's also a lot of interprofessional collaboration with OBs
Mhm.
and having patients that are co-managed by both and finding ways to, okay, as a CNM, I'm going to manage the pregnancy and the OB will be the one managing this, you know, diabetes or this chronic kidney function. And then when it comes
Mhm.
time to labor, we'll talk about what the patient's priorities are and then what our priorities are with regards to safe delivery and having a safe birth space. So, um, yeah.
That's awesome. I think that's great. I actually didn't know that in depth about CNMs, like that
Mhm.
note that you just mentioned of the fact that, there are many things that would risk you out of like a licensed midwife's practice. But since
Mhm.
you are CNM working in hospital, that threshold is kind of raised because you have that interprofessional relationship with the OBs that can help manage a specific part of a patient's health needs and requirements. And then you can primarily focus on the pregnancy.
Yeah, exactly, exactly. And that's also another part of why I chose CNM is that oftentimes a lot of the patients that would love to be with midwives, and whether that's midwives in a home birth or birth center practice versus CNMs in a clinic or hospital-based practice, feel like they can't be with the midwives because of some of their comorbidities, or because, for example, they might be what advanced maternal age, even though that
Mhm.
doesn't really put them in too much of a higher risk category, depending on your age.
Mhm.
And so a lot of our role is education, and we can educate people on no, we can see you. We'd be happy to see you. We manage people who have some of these high risk conditions, and we would love to see that birth that you kind of envision and that you would love to experience for yourself. And I told you
Mhm.
I work at a community health clinic, and we have it's one of the only community health clinics that has a midwifery practice, and a lot
Mhm.
of our patients are higher risk. They, as I mentioned, low resource communities. They're non-native English speakers. They are multips, so they've had
Mhm.
multiple deliveries and multiple births, and those are the patients that need midwifery as well.
Mhm. Yeah. Yeah, 100%. I agree with that 100% because oh man, there's so much that I could say to this. And it's like, where do I start? Like, I think that it's just super, super, super beneficial for the communities that are being served in this manner. And I think that this is also why it's important to have those interprofessional relationships because having these conversations, like having these conversations with breaking some of those like stereotypes of
Yeah,
what CNMs hold and what licensed midwife hold and what OBs hold and like coming together and having that collaborative conversation and being like, this is what it looks like. Instead of focusing all the things that are different, focus on
totally.
all the things that are connected, that everybody can relate on and focusing on the fact that it is patient centered. It is for the patient and it is for their health and their well-being and their safety throughout the care. So I think that's great.
Yeah, yeah. I cannot agree with you more on that. I mean, I hear a lot of stories coming from different birth spaces of, oh, midwives, like they're some stories of like they go rogue and they go, like
Mhm,
in
mhm,
whatever practice setting you are, or and no, really, it's all evidence-based practice. And we have a different spectrum with regards to credentials, with regards to degrees,
mhm.
with regards to different types of birth practices. And so instead of kind of having that binary like way of thinking of like, oh, the CNMs maybe have this over reliance of technology, and the LMs maybe go rogue or whatever, whatever people have
Right.
said, just coming together in a way of like, no, this is our understanding of our standard birth practice, and having clear guidelines of this is when a patient might risk out of care, but I have this connection with a CNM, or I have this connection with an OB, and let me allow for this smooth transition of care and smooth transfer of care, so that you're best set up with the provider who can, provide you with appropriate care,
Mm-hmm.
for you, you know.
Mm-hmm. Yeah. Yeah. 100%. I agree with all of that because, like we've said multiple times already, is it's all about the patient and their individual needs. Because yes, everybody that is out there having babies will continue to have babies, but each individual matters, and what their needs are and their health parameters and requirements and limitations are matter. And so
Hmm.
having those conversations with other providers in the birth spaces can also just do nothing but make the conversations that each patient or client has with their provider that much better, you know?
Hmm. Totally.
Yeah. Another question that I would love to ask is, what was the most empowering or inspiring birth that you've attended out of all of the births that you've attended in all of your roles?
I'm tossed between a few births, and what I'm tossed between is births that are medicated in the hospital and unmedicated for whatever reason.
Mm-hmm.
A lot of times, what I've seen in the current practice that I'm working as a student nurse midwife now, there are people who are very pro medication, and there are people who are like, okay, I could do it. Like I'm hoping not to, but I'm okay with it if depending on how I feel at the time. And then
Mm-hmm.
there are people who are really like set of I'm not gonna use any sort of medication. And I
Mm-hmm.
what's empowering to me is um, women or birthing individuals having all of that, like all of what they sort of envisioned.
Mm-hmm.
One of my most recent births was a patient who came in who was 8 centimeters, like, and baby was pretty low station wise and looked like she was in transition, and this was a first time mom.
Mm-hmm.
And she had came in to triage and said, like, I think I'm gonna go with an epidural if it's gonna be like this for a long time, where she's like in coping with her pain and
Mm-hmm.
really feeling all the feels. And then when we told her, you're pretty close to complete, you can do this if you don't want to do it with medication. She had a doula, and she had a very supportive partner. And then that's exactly what she did. And she delivered that baby in only a couple of hours. And for a primate as well, we were like, wow, like
Mm-hmm.
that was a big thing.
Yeah.
So that's empowering. And the other births, that ones that maybe often involve medication, like an epidural, are empowering as well, because sometimes people have traumatic experiences with prior labors with regards to I didn't get there in time for an epidural, and it was so painful, and it was so like it was not what they had hoped for, not what they wanted, or I had a long induction of labor
Mm.
and it was exhausting, and it ended up with me having an operative delivery, and it might not have been cesarean, it could have been like a forceps delivery or a vacuum delivery. And so getting to the point where they're here for this birth, the subsequent birth, and they're like, give me that epidural, please. Like, I just want to make sure I don't lose out on that one. And they get it, and then they feel so good. They're like, okay, great. And they're laughing in the birth space, and they're like, like they're singing songs, they're listening to music. They also might have a doula, and they're getting
Mm-hmm.
along just fine. When they're getting into active labor and then transition. So both of those types of birth experiences are empowering, because you have that person's capacity of choice and feelings of being in control in a very uncontrollable environment oftentimes.
Yeah. Yes, yes, yes. Yes to all of that. And I think that's amazing because, you know, having it, that's the whole point of everything that providers do, is making
Hmm.
sure that the client has the information to where they have the ability to make a choice.
Exactly.
Right. So it's like a choice to or to not get an epidural. Like I love when, like that first story where you all gave this client reassurance that you're close to complete, and if you want to do this without it, you can. And she's
Mm-hmm.
like, okay.
Yeah.
And they did it, and then also that second client of really being like, hey, I really want the epidural because of X, Y, and Z, even if it's like because I don't want to feel anything. Let that be
Mm-hmm.
it,
Yeah.
and let them have that positive experience of saying like, okay, I'm good now. And the reason why I love these two birth examples so much is because it just kept bringing up the thought to me of what I tell clients all the time, which is that individual is the only one who knows the line between coping and suffering for that
Mm-hmm.
specific individual. And so if that individual is telling you at 2 centimeters they can't do it anymore and they're struggling, or at 4 centimeters, 6 centimeters, they just can't anymore, listen,
Totally.
help them find ways to cope. And if they don't want to try anything else and they want to do what they want to do, and it medically makes sense and is appropriate at that time, cool. you
Right.
know let them have that choice, which I think
Yeah.
is great.
I love that. I love that
Mhm.
as well. Like really meeting people where they are at. Like that's kind of getting into what it means to be a provider, and a really good provider too, is
Mhm.
finding that sort of ground of, your body best. I tell people this, I tell patients this all the time. You know your body best. So if you feel like this doesn't feel right, or if you have a question about it, like ask, and we'll figure it out together.
Mhm.
Yeah, I think it's so important.
Yeah, I 100% agree as well. I mean, I feel like I know the answer to this question already, but as a provider in this birth space, how do you feel about doulas and support people throughout the labor process?
I love them so much. They're just so, so wonderful. And it is different now being in the provider space, because prior I was in the doula support person role. I've kind of had short stints in that role too. And so I'm like in this evolution of like, where am I at in this person's birth space? Okay, like now I'm the provider versus I was over here kind of observing and taking, and providing support.
Mhm.
Doulas are amazing and they're so wonderful, and I've seen the vast. Well, a lot of the births I've seen in this practice in my clinical right now have had doulas. I think prior to me starting clinicals, I always thought, well, CNMs are like, a lot of CNMs have been doulas, and a lot of CNMs know how to be support people. So like, is there really a need? Like, this is me before
Mhm.
I saw any births in clinical. Um, is that really, like, do they really need to do it? Like they have that person, right?
Mhm.
And then I come into the clinical experience. I'm like, yes, please. Like the more the merrier, because they they have wonderful fresh ideas of like, how about we try this position at a time when birthing people might be just very fatigued, or just can't think, very like they might be dehydrated, they might not have
Mhm.
eaten things,
Mhm.
and they kind of navigate that birth space so well, and they don't just take care of that birthing person too, like that partner. They're like, how about you try this, and get the couple to slow dance together and have an intimate moment where maybe that partner didn't know what to do at that very moment.
Mhm.
um, I've seen really wonderful doulas who, in a really long shift, I had 24-hour call shifts. There was a birth where it had been some time since me and my preceptor, my midwife, had eaten. So my preceptor was like, "Can you get us like some crackers and some juice, because we're gonna need it for when this patient delivers." So I go grab it from the break room in the L&D floor, and we're eating it just behind the curtain. We're like eating it super fast and drinking, and the doula comes up to me and she's like, "Is everything okay?" We're like, "Oh yeah, we just haven't eaten lunch in a little bit." And she's like, "Can I get you anything more? Like, can I get you can I get you
Yeah.
some actual food?" We're like, "Oh my gosh." No, but like, thank you so much. It was just a very humbling sort of experience of like
Mhm.
taking care of the birth space and taking care of the people like who are doing different roles in that space.
Mhm.
So doulas are just so lovely.
I think the same thing. I I feel that you know, in the beginning when I first became a doula back in 2016, I still came across this stigma of, well, doulas aren't providers. Doulas don't do much.
Right.
Doulas aren't birth professionals. They could be trained in the backyard of someone's house and blah blah blah. Like all of
Yes.
this stuff, when
Hmm.
really, doulas, no, they're not medical providers, but are they providers? Yes, they are birth professional providers, where they are trained and educated on the physiological aspects of birth and the things that they could do to help a person through and progress the labor process, right?
Hmm.
And I
Hmm.
think that's so important. Is there's I always say that birth is just as psychological as it is physical. And
Hmm.
so a birth doula is very much a psychological support person. So,
Totally.
letting the primary care provider be the primary person to talk about all of the medical and clinical things, because that is their job and what they're aware of, and like the education that they have the background in. The doula can help the client get information on it, like, hey, maybe ask your provider about this study that I came across, or maybe your
Hmm.
provider, knows about X, Y, and Z, or have they heard about this option, but never saying, oh, you need to do this. Like, your
Right.
provider's wrong, like it's very much a team effort. And so I think doulas are awesome. And the fact that they do, I mean, I am biased because I am a birth professional as a doula, but um the fact that sometimes doulas are hired purely for the partner support and not the
Hmm.
birthing person, because the
Yeah.
partner is freaking out like, oh my god, what do I do? And to just get them involved and included, and being the person to make sure everybody in the space is hydrated and fed and rested, which is super cool. And sometimes doulas work in partnerships where they also have this shift aspect, where they are in a partnership and they're like, okay, my shift ends at 7. So the other doula will come in and to give you those fresh thoughts and things
Hmm.
like that. So,
Oh, so many good things of that. My sister calls doulas like a best friend at the birth, and I love
mm,
that. So I used to tell clients that, like, oh yeah, my sister says like a paid best friend at your birth. I'm
yeah.
like, that is so true. And then to your point of, sometimes doulas are hired for the partners. The clinic site that I'm at, we have centering sessions, so we have group prenatal care sessions, and I remember one particular patient or client who said, I know that my husband is going to be the one to just offer solutions. Like, they're going to be like, where I want unmedicated, my husband's going to say, are you sure? Like, you can still get the epidural. Like, you can still get the medication. And that,
Mhm.
and my response is, a doula is so great for that. Like, to be like, well, maybe like let's try this, and to
Mhm.
have those fresh ideas.
Yeah.
Yes. So I
Yeah.
totally agree. And that role of advocacy too, where they
Mhm.
have some of that clinical knowledge to be able to, and some of that background and experience of, I've seen this. And so toying with that and discussing with the birthing person about that to get them to think about things they may not have thought about at that moment. It's great. And why not have another person there at the birthday? Like, I'm such a fan of community and family and
Mhm.
delegating all those types of roles that you can provide in birth and then beyond too. Like, I did,
Mhm.
I was a postpartum doula as well. I love postpartum doulas. I think that people need all the support they can get when they're growing their family and they have a newborn, and and they're adjusting to
Mhm.
life where it might not be just the two of them, where it could be you and your partner, or the three of them if you have another kid, and
Mhm.
and so on. So yeah, doulas are wonderful in all the various ways that they serve.
Yeah, yeah, I agree. And that kind of leads me to my next question, which is about burnout. Like, you
Mm,
know, I feel like providers and doulas, and because the reason why I'm thinking of this as a transition is, swapping, having that shift change, or making sure
yeah.
people get rest to prevent that burnout. So, as a
Hmm.
provider, student midwife, how do you feel about that phrase in general, like burnout, you know?
Uh, Before I started clinicals, 24-hour call shifts made me so nervous. Like as a doula, it also kind of made me nervous to be like that sort of on call. Like they could call me at my client could call me at any point in time. As a provider, like the same. And to have like a full 24-hour call shift where like, oh my gosh, like anything could come up in the hospital setting. So burnout is so real, and it's it's a whole nother skill to be able to know how to take care of yourself and your needs so that
Mhm.
you can take care of that person and come in with like without all the other sort of maybe fatigue or the hunger that you experience. And so this is also why support people and doulas are so great too, because when you need that break from a labor that you might be managing, um, between like in active labor or in that time where this patient is not pushing, there is somebody there. And yeah, and I just think it's so important to take care of yourself. It's so easy to burn out in this field. As a doula, where you're like trying to make it, and you're also trying to be there for your person, for your client. As a provider, when you're managing multiple things. Like oftentimes you don't just have somebody who is in labor. You could have somebody who is going through induction of labor. You could have somebody who is coming into triage. We've had a couple of shifts where we've had people who are like, oh, I think I might be in labor, and managing that. And so to that end, I'm still learning how to be able to be like, okay, I think I need a little break to say that I need to take 10 minutes, like to get some tea or to go to the bathroom and then come
Mhm.
back. Um, yeah, it's a thing, and different practices do it a little differently too. So different practices are higher volume versus low volume. I was very comfortable saying, okay, 1 24-hour call shift and 2 clinic shifts a week for this first clinical. I don't want to overburden myself. And honestly, like I would love to have, I had a couple 12-hour shifts. I would have loved to have 12-hour shifts continuing forward too, because sometimes you really don't know what you're gonna get at 24-hour call. Like
Yeah.
there are times like most oftentimes I've been able to sleep for a couple of hours, but there are times when you're hitting that like there was my last shift, we were hitting the 25th hour, and I'm like, oh my God, like I I'm
Crashing.
so and yeah, I'm so almost not gonna be here.
Yeah.
Um,
Yeah.
yeah. And then also managing patient expectations too when you are transitioning to a different shift. We had one patient so the practice that I'm with is 8 a.m. to 8 a.m. for 24 hour. Or
Mhm.
if you do like a 12-hour, it's 8 p.m. to 8 a.m. In the
Mhm.
morning to evening. And so this patient gave birth at 8:15 a.m. And at 7:50, she was like, how does that transition work? And we're like, we will stay. It is okay.
Mhm.
Because you also have to kind of set expectations and see sometimes you're like I got to see this through. Like I've seen you for this augmentation of labor, if you will, like all of overnight. I've seen it where like the highs and the lows, and I want to make sure that you're okay, and also psychologically, like how does it feel for that birthing person who has maybe developed a connection with the provider and the midwife and has a sense of trust, and to have somebody come on shift for their last 15 minutes of birth, like maybe that's not the best.
Right. Yeah.
And so yeah, so anyways, balancing that sort of taking care of yourself but also taking care of the patient's needs, and you know without burning yourself out.
Yeah. As best as you can, you know? And then
Right.
I'm assuming that even in addition to the things that you've mentioned with like making sure you get as much rest as you can, where you can, make sure that you're eating. And I'm sure it's easy to forget to do those things because you're constantly giving, you know?
Totally. It is so, yeah, because you're thinking about the other person. You're like, have you eaten anything? Have you drinking anything? Like, how are you doing right now? And you also just want to be there for them. Like you want to take their pain away or find ways where they're coping
Hmm.
appropriately and they feel like they're in a safe space.
Hmm.
Um, And so that one birth where we got crackers and juice, like I had totally forgotten we hadn't eaten. Like I was like, I'm fine. Like it's totally
Mm-hmm.
fine. But in the very beginning of when I was observing births as a medical assistant, there was a birth that I almost passed out because I had forgotten to eat. I was like, oh, I'm fine. It'll
Mm-hmm.
be okay. And I got into the birth and we had back to back births. So I had gone from one birth room to the next and it had been like almost all day where I hadn't eaten anything and I was feeling very like lightheaded. So
Mm-hmm.
so getting back to that sort of space of like your own locus of control and like how do I take care of myself even like a little bit to be able to give myself a little bit more energy to attend to this patient's needs. It's so easy to do.
Mm-hmm.
But it's hard.
Yeah.
It's hard to think about yourself when you're thinking about somebody else.
Yeah. I mean, I remember when I was practicing as a student midwife for a CPM credential, which is the Certified Professional Midwife credential for out of hospital birth.
Hmm.
There was this one week where we had 5 births in 5 days. So I barely
Oh,
came home, and when I did, my kids were already sleeping and they're like, I miss you, mom. And I'm over here like, okay, I miss you too. And then I get like an hour of sleep and then I'm called back, and then I get an hour of sleep and I'm called back. And it's not just like, oh, like, let me go to the break room. It's like, I'm already all the way home. And then you call me and say, hey, it's time for you to come back to the birth center because we got another mom coming in. And I'm like, okay, yeah, totally. I got it. But then I had to legit set reminders on my phone or my watch to say, drink some water, you know,
wow.
have a
Yeah.
snack, eat some food, because especially when you do fall asleep and let's say you hit your REM cycle and then
Hmm.
you come back and you're like, okay, I actually feel really rested. Like this is good. And even though I only got maybe 3 or 4 hours of sleep, I'm like pushing through, and then there's a
Yeah.
calm moment and then it's like all quiet and then your stomach is like, rah, 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 you know? And so
Totally.
you
And you're
just,
also like in front of the client or you're in front of the patient and you're so
right. Yeah. And then you just act like nothing happened. Yeah.
yes.
So, yeah, sometimes reminders help, I don't know. It's
Yeah.
interesting, but
I think, yeah, the reminders, um, like knowing also again who you can kind of delegate to and with regards to that partner that might be in the room or that support person or that doula too. I think that's also what makes a good provider is you don't have to be there 100% of the time all
mhm,
the time, but be there as much as you are willing and as much as you can give while also taking care of your own needs so that you can be there when it really counts, when you really need to be there
mhm,
for a person who is, about to give birth. It's hard. And this is why group practices are so important too. Like as a CNM, I really admire how LMs and CPMs are like working with sometimes practices of only 2 or 3
yeah,
providers. I admire that, and I don't know if I'm able to do it. Like you're on call 24/7,
mhm,
and whereas here in our group practice of CNMs, when you're on call, you're like, I'm on call one day out of the week, the 24 hours, or like 2 12s. You
mhm,
have that sort of understanding. You're like, okay, I can take care of my needs the night before and get myself set up so that when I come on shift, I'll be totally, like I have enough sleep. I have like, I'm ready to give.
mhm.
Yeah, I think that is a little, it makes things a little easier.
Yeah, yeah, I agree because, being an observer of what it looks like to run a practice with just one, two, three, even four midwives, like it's a lot. It's a lot of working balance. And because, just like every individual patient or client that you're supporting, every single midwife or provider that you're working with has a family or a life of their
Yeah.
own and has things to balance as well. And so, you know, there's a lot of birthdays that are missed. There's a lot of holidays that are missed. There's a lot of, oh, I'm actually going on vacation and turning off my phone, so don't call me. That needs to happen.
Yes. Yes.
um, that balance, that work-life balance is really important. And I think that a work-life balance is truly only possible when you have a group practice.
Mm-hmm.
So
I totally agree.
even as a doula, like as a birth doula, it was hard to be a solo doula. And I was totally hopped on the opportunity for Mercedes with Mercedes Snyder when we were doula partners. And we just switched, like, we like split the week in half on when we were on call based off of our available schedules. So it was so much easier to know, like,
Mm-hmm.
okay, I'm not on call today. We have a client that's going into labor, but I'm not on call. That's Mercedes. And I can still go to my daughter's concert, something like
Right.
that.
It's just so much relief that you get from knowing like I don't have to be turned on to like
Mm-hmm.
whatever comes my way with regards to client needs, the patient needs. I
Right.
totally get it.
Yeah. There's also, of course, that bittersweet moment of like, oh man, I wish I was on call because I was really connected to that client.
Right, right.
Yeah.
Like I really, I really wanted to see
Hmm.
that one through. I wonder how they're doing. I wonder how their birth went. For
Right.
sure, for
Hmm.
sure.
Yeah. So, what advice would you give to those that are wanting to work with a provider in your field? Like, how would
Mm.
they go about making that happen?
I would say get as much exposure as possible. That's what a lot of people told me when I was trying to decide whether, like, what type of provider I wanted to be, and then also what type of midwife is try to become a doula, or find ways to work in OB, to work in prenatal care, whether that's like outpatient clinics or in the hospital setting, to really gauge how you would do in that space. There are times when people come into sort of our program. So I told you it was a accelerated BSN to doctorate to DMP program. There are sometimes people who come in without any sort of healthcare experience, and that's okay. It is a program that you can do that, but the learning curve's a lot steeper.
Hmm.
And so you're not only in that beginning learning how to be a nurse, but learning who you are as a nurse, and then quickly transitioning to learning who you're going to be as a provider. It helped me so much more that I was a doula before, and also that I worked as in with midwives in the community health setting throughout that whole entire time, and then I worked outpatient too. So my learning curve, where I'm challenged in the hospital setting because I haven't had as much intrapartum exposure, I'm feeling very comfortable in the clinic setting, in the clinic role. And so the other advice that I was given when I was considering all options of medical field with regards to becoming a doctor versus becoming a nurse practitioner is like be around those people in these career fields. So
Hmm.
see if you get along with the other nurses, if you get along with the other providers. Like, do you envision like this is the people, the colleagues that you're very similar to, or you can, like you get excited about. Like,
Hmm.
it was a very, I floated as a medical assistant and also as a registered nurse when I became an RN. Very different spaces to work in primary care with regards to family practice versus the OB setting versus the surgical setting. And with midwifery, I always knew like the midwives that I've all been around have been lovely, warm, very kind individuals. And that's not to say the other types of providers are not, but they're not as similar to like to me, and I
Hmm.
feel more rewarded and I feel more valued in that sort of space. Another advice that was given to me as an undergrad was find a field where you're not looking at the time, like when you're like working at the end of the day, you're like, okay, is it time to go home, find a field where you're
Yeah.
like,
Yeah.
it's already 4 o'clock, or it's already 8 p.m. That's how you know you're super excited about it. That
Hmm.
like you're not checking your time, and you're super psyched to go to your clinical shift. Like, I mean, I think I told you prior to the start that our clinicals were working 40, 50-hour weeks. I love every single minute of it. I like try to pick up shifts when I don't get called in because I'm like, oh, I need the births, I need the experiences, and also I want to learn. Like,
Yeah.
it's so much fun to be in this field, where you're constantly learning as a nurse practitioner, as a CNM student. Um, yeah.
That is awesome. I think that's all amazing. That's just all amazing advice because, with wanting to be a provider in this field, it's good to get that well-rounded background and to truly know, like, like you said, go hang out with people that have the credentials that you're trying to get and see if you can imagine them being your colleagues. Like,
Hmm.
or is that what makes you feel comfortable? Does it touch your soul, to like
Totally.
actually be with these people? So I think that's great advice. Yeah. And the ways that people just talk about their work, like, are they complaining or are they excited?
Hmm.
Yeah,
Yeah,
I think that's
totally,
awesome.
totally. As an undergrad, I like connected with I had like this idea of like maybe I like surgery. So I connected with friends who knew anesthesiologists, who knew surgeons. And then I found that like surgeries are really cold. Like I'm like it's
Mhm.
very cold in the operating room, and it's very impersonal. And then that, like, for whatever surgery you might need, like whether it be orthopedic surgery, whether it be some sort of like internal medicine surgery versus the cesarean section room where
Mhm.
it's warm because we want to warm up
Mhm.
the environment for baby and stuff. Like, okay, like this is
Yeah.
great. This is, I can do this in the
Yeah.
operating room. So, yeah, it's really finding, getting as much exposure as possible so that you
Mhm.
understand, like, okay, this is I think I can do this. Like, this is how I see myself
Mhm.
in the future, you know?
Yeah. That's great. I love it. And I think that that's a good point is I can imagine how surgery outside of it, like outside of a cesarean section, how surgery is very cold. It's a very sterile space. It's a very, cold space. And a lot of the time, many people are put completely under anesthesia to complete a procedure. So it is very impersonal to where you don't really get to talk to that person very much and see like, hey, can you feel this? Like, and yeah, going through that. So that's interesting. That is a very interesting perspective and I appreciate it a lot. So thanks for that.
Of course.
Yeah. So when it comes to pregnant people and birthing families, how could they find someone that works in your field? Like, how could they find a provider to work with?
Mm, yeah, that's a very good question. I think doing as much research as you can with regards to the different types of midwives in your area,
Hmm.
in the community. Sometimes people find doulas before they find providers. It's kind of rare, but sometimes they do, and then they ask them who are the providers that they know that they've enjoyed working with. Um, a lot of referrals that we get are through people who know a person who's used that
Hmm.
provider. And so
Hmm.
asking your community around you, like, well, how was your birth experience? Did you enjoy it? What things do you wish you could have done differently? Or
Hmm.
um, I think those are the biggest things. I think a lot of people don't know sort of like you can have the different types of midwives. So that spectrum of like licensed midwives, CPMs, nurse midwives. And then you could also have different types of like doctors, like family
Hmm.
practice doctors. You can have OBGYNs, and then you can have maternal fetal medicine specialists. Those specialists are a little bit more on like you need a referral because you'd be kind of in the higher risk category to get MFM. But
Hmm.
knowing that there's different types of providers in all spectrums and doing your research a little bit more about that
Hmm.
is important. And then just find the people you vibe with. Like you're not set in stone if you find one provider and you have an appointment and then you're like, okay, like, that was cool. I can maybe I'll give it another try and you just keep going. You can change at any point. If you feel like you don't vibe
Hmm.
with a provider, like go to a different practice and go see what that's like. Just get a sense of like exposure to the different practices around your area. I think it's super important.
Yeah, yeah, I agree with that. And I think another great thing that I would add on to it that that popped into my head when you were speaking was consultations.
Hmm.
People offer consultations, and most of the time, consultations are free. So if you don't have insurance, you can still speak with someone, ask
Right.
questions. And yeah, there are consultations before you even like solidify that that's the person you want to be your primary care provider for your pregnancy. Consult with them. Some people even
Hmm.
have like preconception consultations like, hey, if I want to start trying to have a baby, what do you offer? What can I come to you for support for? So,
Yes.
yeah.
Yes, totally agree. Like the practices that I work with and as a student and then also as an OBRN, the community health practice that I work in,
Mm-hmm.
we often have like nurse visits. And so you meet with a nurse first and then they help to like lay out all those options for you. So yeah,
Mm-hmm.
that's so important. And like ask all the questions too. Like sometimes people don't know what to ask, I think, with
Mm-hmm.
regards to, oh, I didn't know there were different types of providers. Like I thought I just see an OB or whatever. Oh, you guys, where do you give birth? Like, first of
Mm-hmm.
all, like what hospital do you give birth in? That's also important. Like, how does my prenatal care look? Am I going to see you as like if you're a midwife in a group practice, is that who I'm going to see? And then are you going to be there for my birth versus like sort of a group practice setting where you're like go see all the different types of midwives you can during your prenatal care, so maybe you're not super surprised at who's going to be on call
Mm-hmm.
for your birth, you know. So
Mm-hmm.
just how does that look for you when it comes time to give birth, you know?
Yeah, yeah. I think that's a great point with being able to cycle through, if it is a group practice, meeting all of the midwives so that you are aware of at least seeing all of their faces,
Yeah.
and them, looking through your chart and answering any questions and going from there.
Totally.
Yeah. If you could describe your profession in just one word, what would that word be?
One word. Oh, this one's hard. Okay. I mean, how it's been described and how I really love midwives and nurse midwives is that this is not one word, but it's going to be normal physiological birth. Like we support normal physiological birth. And
Mm-hmm.
that's however that looks, that
Mm-hmm.
doesn't necessarily mean um, vaginal unmedicated birth. That could mean vaginal medicated. That could mean
Mm-hmm.
operative delivery for somebody who wants to have a C-section, or whether that be elective because they've had a repeat C-section. Just how
Mm-hmm.
normal physiological birth is, that is patient-centered, that involves shared decision making, that involves emotional, social, spiritual, and physical connection and support.
Mm-hmm.
Um, yeah, that's how I would describe it. I know that's way
Great.
more than one word, but
No, that's okay. That's okay. Normal physiological birth. I think that's awesome because that's what providers that are supporting birthing families train in, right?
Mhm,
Like normal
exactly.
physiological aspects of birth. So that's good. I love it.
Some people get tied up on the word normal, and I do too sometimes. And I'm like, normal is whatever it looks like for that person. Like, it's not
Yeah.
just like a standard set of normal. It's like, what's your normal?
Right. Yeah. Personally, like the word normal to me is the most unnormal or
Yeah,
unnatural word ever.
exactly.
Because
Totally.
what is normal,
Hmm.
Yeah. So, like what you just said, what is normal for that person? Like,
Yeah.
is it normal for this person to get cesareans because that's how they feel safest? Is it
Hmm.
normal for this person to have precipitous births with 10-pound babies? Like what is normal, right?
Right.
So, it's
Right.
very individualized and very unique to each individual. So, yeah.
Exactly.
If you could offer a resource for any listeners, do you have a specific one in mind?
I think so. Our accrediting organization, ACNM,
Mm-hmm.
is often can be a good resource for people. American College of Nursing. I think it's a good resource for students who want to learn about nurse midwifery.
Mm-hmm.
It also can be a good resource for patients who just want to learn about CNMs in general. And I believe there's a section of this website where it shows like our state accrediting organization, so like Washington State, and where you can potentially find providers. So I'd probably point towards ACNM.
Great. That's awesome.
Yeah.
I'll check it out too. Get a little bit more info. Yeah, because I mean, for me, I trained as a CPM, and the reason why I chose the CPM route is because I knew I wanted to do out of hospital birth. But as I chose that route, I didn't know or even comprehend the fact that certified nurse midwives also can offer out of hospital birth. It's just up to
Mm-hmm.
that individual once they're done with their practice credentials and everything like that, like what they choose to do with their license, you know, but which is interesting. And that holds that's a whole different discussion, but I think it's awesome. And I think it's good to just continue to learn more and just broaden your knowledge every single day. So
Yeah, agreed. I mean, we talked a lot about, I think it's just learn as much as you can about all the different things. And so then you have sort of that understanding of how that particular provider is trained. As a CNM, I mean, I would say most CNMs are in the hospital setting. Most of them don't have birth center or home birth practices, but they're certainly not limited. The big thing training wise is that they're nurses before they become nurse practitioners. And so, so that's just kind of their scope of practice and how their training is. And that's another thing that people also can learn about too, is like, how does that influence them as a provider? I mean, I know that some patients or clients might not be like so heavily focused on like, oh, like that sort of training and specialization and credentialing, but some people that matters to them. Like, what is that specific practice as a nurse and now becoming a provider? How does that translate versus like an MD or a DO where they're providers like through and through?
Yeah, I think it's definitely worth looking deeper into for all the reasons of just knowing how someone got to where they are, you know?
Yeah, exactly.
Awesome. Well, Muna, thank you so much for coming and sharing your journey on the podcast and just talking to me and letting me pick your brain and like just connecting again. I'm really thankful for it and I appreciate it.
You're so welcome. I am so flattered that you invited me onto this podcast, and I have been so enjoying seeing where you've been at and how you've come to this point. I love hearing about all the different types of people's birth experiences that you've been able to interview, and yeah, I just love watching you grow.
Thank you. Thank you. That means a lot. Interviewing Muna for this episode was a lot of fun, and I loved picking her brain after she's done so much education and background to become a student where she's at now. And it was great to connect with her again, especially since I connected with her previously many years ago when she was first getting into birth work. So it's really awesome to see how far she has come. I'm also really ecstatic to see how she practices as a provider once she's licensed and to see how her impact of creating that seamless interprofessional relationship with out-of-hospital providers can really help the community with their birthing outcomes. Next week, we'll be hearing 2 birth stories from an old friend of mine named Darian Steady. Darian talks about 2 birth experiences that she has had that were traumatic, but then again, they weren't. So tune in next week to hear about how that turned out for her and why she feels that way. And all in all, I want to thank you for listening to the podcast and for supporting the podcast by just tuning in. If you're enjoying the podcast, please leave a review and just let people know how you feel because it's super easy. It's really quick. You can just type in a small sentence. It doesn't have to be big. You could say, I love the podcast, and put those 5 stars and hit submit for other people to see. So that would be really helpful so that we can get more people learning about birth through storytelling. If you want to support the podcast in an additional way, you can join the Baki community through my Patreon page. Right now, I just have a tier offering of $3, which is less than a cup of coffee these days, and that will help support the podcast's production and make it possible for me to continue to teach people about birth through storytelling. So thank you so much, and I look forward to connecting with you all again next week. Bye for now.